What would you do if you suddenly felt crushing chest pain and were completely alone, with no one to call for help? The next 15 minutes could literally save your life by teaching you 7 proven emergency actions that can significantly increase your chances of surviving a heart attack when no one else is around. Most people get the third tip completely wrong, but it's possibly the most critical one that cardiologists say could buy you precious extra minutes when every second counts. Last year, Barbara from Ohio was home alone when she felt a sudden tightness in her chest, spreading to her left arm. Instead of panicking, she remembered these exact emergency techniques we're about to discuss and took immediate action. Today, her cardiologist credits her quick thinking as the primary reason she survived what could have been a fatal heart attack. Tip 1. Recognize the warning signs immediately. The first critical step to surviving a heart attack when alone is knowing exactly what a heart attack feels like, because it's often not what you expect. According to the American Heart Association, nearly 50% of heart attack victims delay seeking help because they misidentify their symptoms or hope the discomfort will simply go away on its own. Many people expect dramatic chest-clutching pain like we see in movies, but the reality is that heart attack symptoms can be much more subtle, especially in women and older adults. The danger in this misunderstanding cannot be overstated, as proper recognition is your first line of defense when facing a cardiac emergency alone. Frank dismissed his intermittent arm pain as muscle strain from gardening until it was almost too late, not realizing it was a warning sign of an impending heart attack. This common mistake highlights why understanding the true warning signs is so crucial for everyone, particularly seniors living independently. Every minute of delay increases your risk of permanent heart damage or death by approximately 10%, making rapid recognition the difference between recovery and tragedy when you're by yourself during a cardiac event. You must memorize these 5 key warning signs that could indicate a heart attack in progress: chest pressure or discomfort that feels like squeezing or fullness, pain or discomfort in one or both arms, the jaw, neck or back, shortness of breath with or without chest discomfort, breaking out in a cold sweat for no apparent reason, and unusual fatigue or sudden dizziness. These symptoms may come and go and can vary significantly in intensity, which is why many people, especially seniors, mistakenly attribute them to less serious conditions like indigestion, muscle soreness, or simply getting older. Understanding that heart attacks often begin slowly with mild pain or discomfort is essential knowledge that could save your life. Don't second-guess these symptoms if you experience them. They demand immediate action, especially when you're alone and have no one else to assess your condition or call for help. Your survival may depend entirely on your ability to recognize these warning signs and respond appropriately within those first critical minutes. Tip 2. The emergency call protocol. What's the very first thing you should do when you suspect you're having a heart attack and there's no one else around to help? This decision is perhaps the most important one you'll make during the entire emergency. Emergency medicine specialists at the Mayo Clinic emphasize that calling 911 before doing anything else gives you the highest probability of survival. Yet many seniors hesitate to bother emergency services or attempt to drive themselves to the hospital. This critical mistake can cost precious minutes when professional intervention would have made all the difference in your outcome. Linda saved precious minutes by calling 911 before even looking for her medication or trying home remedies when she experienced chest pain last winter. Her quick action allowed paramedics to arrive while she was still stable enough for effective treatment. Without professional help and the advanced equipment available in ambulances, your chances of surviving a severe heart attack drop by over 30%. A risk no one should take when minutes literally determine whether heart tissue lives or dies. You must keep your phone within reach at all times, especially if you have known heart concerns or risk factors. Program emergency contacts into your speed dial. Consider wearing a medical alert device if you live alone, and immediately call 911 at the first sign of possible heart attack symptoms, even if you're not completely sure. Never attempt to drive yourself to the hospital, as this puts you at risk of losing consciousness while driving and delays the start of life-saving care that paramedics can provide immediately upon arrival. Remember that emergency responders would much rather treat a false alarm than arrive too late for a real emergency. Those first moments are critical. Make that emergency call, even if you're only suspicious something might be wrong, as early intervention provides your best chance of survival and recovery when facing a heart attack alone. Tip 3. The chewing aspirin technique. This next action might be the most misunderstood yet potentially life-saving step when you're alone during a heart attack, and getting it right could make a tremendous difference in your outcome. Cardiologists at Johns Hopkins confirm that quickly chewing one regular adult aspirin, 325 mg, can reduce the severity of a heart attack by preventing further clotting in your arteries. The key detail most people miss is that the aspirin should be chewed rather than swallowed whole, as this allows it to enter your bloodstream much faster, within minutes rather than the 20-30 minutes required for a swallowed pill to dissolve and take effect. Thomas kept a small aspirin bottle in multiple rooms of his house after his doctor's recommendation, ensuring he'd always have quick access regardless of where he might be when symptoms struck. This simple preparation played a crucial role when he experienced his own cardiac event last year. Without aspirin's blood-thinning properties working quickly during a heart attack, clots can continue growing, blocking more of your heart's vital blood supply and leading to greater damage that could have been prevented with this simple intervention. You should keep uncoated regular aspirin, not enteric-coated or baby aspirin, easily accessible in your home, perhaps in your bedroom, bathroom and kitchen, and chew one adult aspirin after calling 911 if you suspect you're having a heart attack. It's important to note that this recommendation only applies if you aren't allergic to aspirin and haven't been advised by your doctor to avoid it. The action of chewing breaks down the aspirin quickly, allowing your body to absorb it through the tissues in your mouth and stomach lining, potentially beginning its clot-fighting work before emergency responders even arrive at your door. This simple action can begin working within minutes to help preserve your heart muscle by preventing the existing clot from growing larger, potentially saving significant portions of your heart from permanent damage while you wait for professional medical help to arrive. Tip 4. The correct body position. Do you know the single best position to place your body in while waiting for emergency services during a suspected heart attack? Most people don't realize that how they position themselves can significantly impact their heart's workload during this critical time. Research from the American College of Cardiology shows that proper positioning can reduce strain on your heart by up to 25% during an emergency, allowing your struggling heart to work more efficiently with less oxygen demand while you wait for help to arrive. This positioning technique is rarely discussed, but could make a meaningful difference in your outcome when every heartbeat counts. When Margaret felt her symptoms begin last autumn, she immediately sat in a semi-reclined position with her legs elevated slightly, remembering the advice from her cardiac rehabilitation program. Lying completely flat or remaining fully upright can make your heart work harder when it's already struggling, potentially worsening the situation as you wait for emergency responders to reach you. The goal is to find a position that minimizes cardiac strain while ensuring you can still breathe comfortably during those critical waiting minutes. You should position yourself in a semi-reclined position with your upper body elevated at about 45 degrees and your knees slightly bent, similar to a comfortable recliner position. If possible, loosen any tight clothing, especially around your neck, chest, and waist, to make breathing easier and reduce restriction. This position helps optimize blood return to your heart while minimizing the work required to pump blood throughout your body. If you begin to feel lightheaded or short of breath in this position, adjust as needed for comfort, as individual needs may vary depending on your specific situation and the type of cardiac event you're experiencing. Adjust your position immediately after calling for help. It can significantly reduce the workload on your heart during those critical waiting minutes, potentially preserving heart muscle and improving your chances of a better recovery once treatment begins. Tip 5. The emergency door protocol. This critical step is overlooked by 80% of people having a heart attack alone, yet it could be the difference between being found in time or not when emergency responders arrive. Emergency response teams from the CDC report that locked doors and inaccessible homes delay treatment in nearly 30% of cardiac emergencies, creating preventable barriers that waste precious minutes when time is the most critical factor in survival. This simple preparation step costs nothing yet could literally save your life during those chaotic moments when help is trying to reach you. Robert unlocked his front door immediately after calling 911, allowing paramedics to enter without delay when they arrived 7 minutes later while he was becoming increasingly weak. His quick thinking saved critical minutes that would have been wasted trying to gain entry to his home. Each minute, paramedics spend trying to find your address, locate the correct entrance, or gain access through locked doors reduces your survival chance by approximately 7 to 10%, a risk that can be eliminated with simple advance planning. You must unlock your front door and turn on outside lights after calling 911 so emergency responders can find and enter your home quickly without barriers. If you live in an apartment building or gated community, make sure to tell the 911 dispatcher any access codes or specific directions needed to reach your unit. If possible, send someone to wait at the entrance of your building or at the street to flag down the ambulance, though this obviously isn't an option if you're completely alone. Consider installing a lockbox with a spare key outside your home that emergency services can access with a code you provide to the 911 dispatcher. Do this immediately after calling for help. Those saved minutes could literally be the difference between life and death when emergency responders are racing against time to begin your treatment during a heart attack. Tip 6. The coughing CPR technique. What can you possibly do to help yourself if your heart actually stops beating or develops a dangerous rhythm when you're completely alone with no one to perform CPR? This question leads us to a controversial but potentially valuable technique that every person living alone should at least be aware of. While controversial and not officially recommended as a substitute for proper CPR, emergency medicine researchers at the Cleveland Clinic note that forceful coughing may help maintain minimal blood flow temporarily during certain types of cardiac events. This technique, sometimes called cough CPR, creates pressure in the chest that can help squeeze the heart and maintain some circulation in dire emergencies. Edward used rhythmic coughing to maintain consciousness until paramedics arrived during his cardiac event, after learning about the technique from his cardiac rehabilitation program. Without some blood circulation, brain damage can begin within just 4 to 6 minutes of cardiac arrest, making any method of maintaining even minimal blood flow potentially valuable when you have absolutely no other options available. It's important to understand that this is an absolute last resort when professional help is still minutes away and you begin to feel yourself losing consciousness. You should try taking a deep breath and giving a forceful cough every 2 seconds if you're still conscious, but feel your heart beating irregularly or feel yourself starting to lose consciousness. The cough must be deep and prolonged, similar to coughing when something is stuck in your throat, not a gentle clearing of the throat. This creates momentary pressure in the chest that can help maintain some blood flow to the brain. This technique is most likely to be helpful in very specific scenarios where the heart is in an abnormal rhythm rather than completely stopped, and should never delay calling 911 or be considered a substitute for proper medical care. This technique isn't perfect and isn't suitable for all cardiac situations, but in a dire emergency when alone, it might buy you precious extra moments until professional help can reach you and begin proper life support measures. Tip 7. The Emergency Information Kit. The final critical tip could make the difference between receiving the right treatment immediately or facing dangerous delays once medical help arrives at your door. According to the American College of Emergency Physicians, having your medical information readily available can improve treatment decisions by up to 50% and significantly reduce the risk of medication interactions or inappropriate interventions during an emergency. Many seniors take multiple medications or have complex medical histories that emergency responders need to know about quickly. Yet this vital information is often scattered or inaccessible during the chaos of an emergency. After her first heart scare, Jennifer created emergency information sheets listing her conditions, medications, allergies, and doctor contact information, then placed copies on her refrigerator, in her purse, and near her bedside phone. Without quick access to your medical history, emergency treatments might be delayed while responders attempt to gather this information, or inappropriate medications might be administered because responders are unaware of your allergies or current prescriptions. Every minute spent searching for this information is a minute not spent on life-saving treatment. You need to create a simple emergency information sheet that includes your full name, date of birth, medical conditions, current medications and dosages, allergies, emergency contacts, and primary doctor's information. Keep copies in obvious locations throughout your home, on the refrigerator, where emergency personnel are trained to look, near your bedside, in your wallet or purse, and perhaps near your favorite chair if you spend much time there. Consider wearing a medical ID bracelet if you have serious medical conditions or allergies that emergency responders should know about immediately. Prepare this today. It takes just 15 minutes, but could save critical time when seconds count during a heart attack or other medical emergency when you're alone. These 7 emergency actions: recognizing symptoms immediately, calling 911 without delay, taking aspirin correctly, positioning your body properly, unlocking doors for quick access, using coughing techniques if necessary, and having your medical information readily accessible, form a complete survival protocol that could save your life when facing a heart attack alone. Thousands of seniors who've prepared themselves with these exact techniques have survived heart attacks even when completely alone. Your awareness and preparation put you in control, even in the scariest moments of a cardiac emergency. Have you ever experienced any heart attack warning signs or had to use any emergency techniques? Share your experience in the comments below to help others learn from your situation. If you found these potentially life-saving tips valuable, please hit the like button and subscribe for more health information that could save your life or the life of someone you love. Share this video with friends and family members who live alone. You might be giving them the information they need at exactly the right moment to survive a heart attack when no one else is there to help.